All right, good morning again, everybody. Joe Gladys, your Medicare consultant with flexible benefit, and as I mentioned, I have Larry Kassman in here. I want to thank you so much for taking the time out of your day to join us on this webinar, and I also want to applaud you guys for taking action and looking at this opportunity that we have in Medicare. So welcome to this morning's webinar. We're going to go ahead and get things started for you right now. Maybe. All right, as we do with every one of our webinars or seminars or any of our trainings, we always want to just give you a quick overview of who Flexible Benefits is, just in case you're not as familiar with us. But at the end of the day, we are a general agency located in Rosemont, Illinois. We have about 75 full-time employees, and we basically handle two general business segments. We have our general agency side, which Larry and I will be talking to you from today, helping our brokers out there with individual, group, and Medicare sales. And then the other side of our business is actually benefits administration. And in another slide here, I'm going to tell you a little bit more about that. All right, on the general agency side, we like to say that we offer you concierge-like services for producers in the group, individual, and Medicare marketplaces. At the end of the day, what we do is provide you with assistance with sales, service, marketing, and business processing functions of your business. Down below on the slide, you'll see some of the carriers that we work with out there in these spaces. Not all of the carriers, but a lot of them that we work with. All right, on the benefits administration side, and that's actually where this company got its start. On that side of the business, we do things like flexible spending accounts, health reimbursement accounts, your health savings accounts, COBRA, WRAP documents, all kinds of defined contribution type plans. And those are all in-house, so they're priced very competitively. So if you're working with clients that need these services, please let us know and we'll get you over to that side of the company because they do a fantastic job with these products. All right, so let's dive in here and take a little look at you being new to Medicare and what is the path forward for you. Hopefully at this point, a lot of you have probably attended our ABCDs of Medicare webinar, which gives you the basics and the breakdown of how Medicare works. So this is kind of the next step in the process. Okay, I've decided I want to get involved with Medicare. Now what do I do? You know, there's so much happening in the marketplace right now. There's so much turbulence, everything that's been going on with the ACA. Of course, the fact that now with the SEP under 65 market, we're not getting paid for submitting business. Well, Medicare is a great opportunity for you to replace that income. So again, I'm really grateful that you guys have taken the time to join us and learn more about this opportunity. And I think you'll see why I personally get very excited about the opportunity available to brokers in the Medicare space. And most importantly, of all these business segments that we work in, group, individual, and Medicare, Medicare is by far the most stable. And I can tell you that it pays, and it pays you pretty well. And there's tremendous opportunity, as we'll talk about in the next few slides. So did you know that beginning in 2011, 77 million members of the baby boom generation began turning 65. At this point, baby boomers are turning 65 at the rate of somewhere around 12,000 people every day for the next decade. So there's a ton of people out there that need help with their Medicare choices. This breaks down to about 1 every 7 seconds turning 65 in America. All right, a couple more stats to throw at you here. By 2025, 1 out of every 5 Americans will be 65 or older. Just about 15 years ago, that number was about 12%. That's how much the over 65 population is expanding in America. And here's a great stat for you. Seniors control 75% of the wealth in the United States with an estimated staggering $7 trillion, not billion, $7 trillion squirreled away. So a lot of seniors do have some money to work with. It's up to us to put the right benefit package together to meet their needs. Okay, and here's a really great stat that I really love. If a couple reaches the age of 65 in relatively good health, today there's a 1 in 2 chance that one of them is going to live to be the age of 94. Think about that. That's a really long time to be living in retirement, trying to stretch your retirement dollars, being on Medicare for nearly 30 years. Okay, that's a long, long time. And our parents' generation, when we were growing up as kids, if people passed in their 60s or early 70s, you didn't think anything of it. It was no big deal. Now there's a chance that 1 out of every 2 people is going to live to the age of 94. It's pretty crazy. All right, there's some real fear, though, as I just mentioned. A 65-year-old couple retiring in 2013 can expect to incur about $220,000 in medical costs during their retirement. So while these people have maybe scored away a lot of retirement dollars, and this is only part of the population, there are a lot of people out there only living on their Social Security checks in retirement. But if you look at that number, $220,000, that's a big chunk out of the nest egg for medical expense. So people are worried about that. It's up to us as brokers and advisors to help the client find the right solution to help minimize that damage to their retirement nest egg. All right? The unpredictable cost of illness and health care is by far the baby boomers' biggest fear. There's no doubt about it. We know the cost of health care has continued to increase in the United States, and it's a legitimate concern. It's eating into our dollars. There's no doubt about it. Okay, the next couple of slides are why I really, really, really get excited about the Medicare opportunity. And you're talking to a guy that when he first started his career in the health insurance industry, I didn't want anything to do with Medicare for a lot of the reasons I hear from our broker community. Oh, the certification, the compliance, all these things, right? Well, now my entire life is pretty much dedicated to working in the over 65 market because I realize there's tremendous opportunity, and the seniors are incredibly grateful for sharing the knowledge that you have with them because they're confused about what their options are. So if you look at this graph right here, I don't think it's news to anybody right now that, as I mentioned a few slides ago, that over 65 population is exploding in the United States. If you go along the bottom and look at where we're at here in 2016 and draw a straight line up to the second line showing the population 65 and over, you can see we're right at the cusp of a massive explosion of the Medicare opportunity. Okay, and then the line down below shows, again, what I was talking about a few slides ago. The number of people living past 85 is also dramatically increasing. So there's more people available, they're living longer, and we need to help them preserve their resources by getting them into the right Medicare plan. So there's a lot going on right now with this opportunity. Hopefully this slide really drives it home for you guys on just how massive this opportunity is. All right, on the previous slide, we saw how the population is exploding. There's also another factor that I don't have on a slide here, but I want to share with you guys, and that's the fact that the broker population itself is also aging. Along with the baby boomer population, our broker population is aging significantly, and there are not a lot of younger people coming into the field. So what this means is going forward, the population is increasing, and we have less agents available to help these people. So there's even greater opportunity out there for those of you who want to take advantage of this opportunity. This is the slide that has always driven home the Medicare opportunity to me. And I want you guys to kind of digest this one. This is an important slide. The top line, one agent for every 185 Medicare supplements sold in this country. What does this mean? Again, for every 185 supplements that are currently sold in the United States, only one of them is being written by an agent. Think about that. Where are the other 184 going? Well, think about it. Every time you turn your computer on, there's a banner ad from United Healthcare, Blue Cross Blue Shield, Humana. Ask us about Medicare. Find your Medicare solutions, whatever it is, right? They have tons of operators standing by ready to take that phone call. Why don't you take advantage of it and get paid instead of letting it just go in-house to one of these carriers? It gets worse as we go down the line here. For every 2,250 Medicare prescription drug plans written, only one of them is currently being written by an agent. The bottom line is the killer. For every 4,090 Medicare Advantage plans, only one of them is being written by an agent. Think about that. The first-year commission on a Medicare Advantage plan, it's all set by the government. We get the same, whether it's United Healthcare, Blue Cross, Humana, or any other carrier in the space, is $429. If you do the math, remember there's about 12,000 people a day turning 65? So just on that 4,090 applications written, if they were all Medicare Advantage, it's about $1.75 million of commission being left on the table by agents not capitalizing on this opportunity. So if you multiply that by 3, there's somewhere around $5 million, somewhere in that neighborhood, being left on the table every single day. I don't know about you guys, but I want a piece of that action. I've put one kid through college. I've still got 2 more to go. So I need some of that money. And today, again, with the fact that you guys aren't getting paid for under 65 sales, how are you going to replace that income? Medicare is the perfect opportunity. All right, let's dive down a little deeper into the Illinois market here. Right now, we have almost 2 million Medicare beneficiaries in Illinois and about 1.1 million in the Chicago metro area. We've got about 420 people turning 65 every day in Illinois, and over half of them are right here in the Chicago metro area. I know this is going to be stunning for everybody on the webinar right now, but Joe's going to share a little piece of information with you. In Illinois right now, about 29% of the population is enrolling in a Medicare supplement. Only about half of that number, about 15%, are enrolling in a Medicare Advantage plan. Where does everybody else go? Well, about a third of the population gets their senior benefits. Either they're still on a group plan and they're still working, or they get a retirement plan through work, or they may be federal employees who get their benefits that way. So about a third of the population is not currently enrolled in any type of Medicare, be it original Medicare, Medicare Advantage, or a Medicare supplement. But everywhere else in the United States, Medicare Advantage outsells Medicare Supplement by the numbers that you see here, about a 2-to-1 ratio. The rest of the country has figured out that Medicare Advantage is actually the better opportunity going forward. And we're going to talk a little bit about that over the next few slides. Okay? What does it tell you that Blue Cross Blue Shield got back into the Medicare Advantage game 3 years ago? They see where the future of Medicare is going. They are by far the biggest provider of Medicare supplements in Illinois. But last year, they sent a letter right before open enrollment started to all of their clients enrolled on a Medicare supplement, telling them that there might be a better option for them with Medicare Advantage, and would they be interested in learning more about that. So what does that tell you guys? Medicare Advantage is the future. All right, so as I mentioned at the top, hopefully by now most of you have attended our ABCDs of Medicare webinar, or you have a basic understanding of how Medicare works. But I'm just going to take a brief moment to just go back over it again, just to make sure that we're all on the same page here. All right? There are 4 parts to Medicare. That's why we call our basic presentation the ABCDs of Medicare, because there's a Part A, there's a Part B, there's a Part C, and there's a Part D. Part A, Original Medicare, basically covers your hospital benefits. Okay, somebody gets hospitalized, I need help, Original Medicare will cover that. Okay, most people in America get their Part A automatically when they turn 65. Part B is the part that helps with things like doctor's costs, outpatient testing, outpatient care, some preventative services, things like that fall under the Part B bucket. With Part B, typically you actually have to take the step and call Social Security to get enrolled in Part B. I'm retiring, I'm coming off the group plan, I need my Part B to start 3 months from now or whatever it may be. So you do have to take an active step and get enrolled in Part B. And Part B does have a premium. Okay? Part A, most people in America get for free. Part C is Medicare Advantage. These plans combine the benefits of A and B into one package. By law, Medicare Advantage plans have to cover everything that original Medicare A and B cover. The individual never gives up their rights to original Medicare if they decide to enroll in a Medicare Advantage plan, They're always able to go disenroll from that Advantage plan and go back to original Medicare if they so desire. Okay? Most of the Medicare Advantage plans that we sell here in Illinois also include the Part D, the prescription drug plans. So everything is in one nice, convenient package, and we'll talk a little bit more about the benefits in a moment. Okay? Part D, which started in 2006, is the prescription drug component. Prior to that in 2006, prescription drugs typically were not covered. And let's face it, for most of our seniors, their biggest month-to-month expense is the cost of prescription drugs. And that's all that's been in the news, if you've been paying attention over the last 5, 6, 7 months, is the escalating cost of prescription drugs in the United States. It's getting crazy. The cost of some of these drugs is just outrageous. Now, where the Medicare supplement fits in is, remember, under original Medicare, the government's going to pay 80% of the claim. The Medicare supplement comes in and covers the 20% that the original Medicare does not cover. So that's where the Medicare supplement fits into the benefits. All right, so let's dive in a little bit deeper and start talking about selling Medicare policies, because that's what it's all about. In order for you guys to make any money, we got to go out there and market these policies. All right, well, what's really important when you're going to go out and start helping seniors and selling Medicare is proper education. That is the key, not only for you as the producer, but also for the client. Okay, first, you as the producer need to be educated on all the different options that are available for our seniors. And then depending on what area you're marketing in, you need to know what plans are available. If you're strictly in Cook County and work in the Chicago market, you need to know what plans are available. If you're working the collar counties, Lake Will, Kane, Kendall, whatever it may be, you need to know what plans are available in those counties, okay? So it's up to you to do the education on your end so that then you can inform your clients. And I always look at it as ethically, it's our responsibility to educate our client on all of their options. We have far too many brokers in Illinois that simply offer Medicare supplements because they're easy and you don't have to certify and you don't have to put the time in. You just simply say, hey, here's a great option for you. For somebody turning 65, a Plan F supplement is going to cost them somewhere around $160 a month. Throw in a drug plan for $20 or $30 a month, and you're taken care of. And people look at that and say, hey, that's a great deal compared to what I was paying on my group plan. But, and I'll show you in a few slides, the Medicare Advantage may be an even better opportunity for the client. Because again, remember, these people are living longer, they're healthier, and their biggest concern is my money going to last. And Medicare Advantage can be a great opportunity to help these people hang on to their hard-earned dollars. Okay? So I look at it from your end, it's actually your responsibility to get certified and ready to sell Medicare Advantage and prescription drug plans. Yes, I'm telling you, you need to do this. It is your responsibility to do this. Because if you go into and sit in front of that client and all you offer them is the Medicare supplement, have you really told them the whole story? Is that client able to make an informed decision? I can't tell you how many times I've gone out and done an ABCDs of Medicare presentation in front of a group of 30, 40, 50 people, and people who've been on Medicare for 10, 12, 15 years, they have no idea what Medicare Advantage is, they have no idea how it works, because when they first retired, their broker went in, put them on a supplement, and said you'll live happily ever after. But again, the fear is real. They need to be able to preserve their money, and Medicare Advantage can be a great opportunity. In my own personal book of business before I joined Flex, I look at my job, I tell every client I sit down in front of, I come here to educate you and answer your questions. I'm never going to tell you what to do. And through that process, 80% of my clients choose Medicare Advantage, about 20% of my clients go on to a Medicare supplement. Remember the slide a few slides ago that said, in Illinois, it's 2-to-1 Medicare supplement to Medicare Advantage. So ultimately, what this all leads to is that well-informed clients can now make the plan choice best suited to their needs, their budget, and their lifestyle. Because it's really about them. It's not about you. If you sell them a supplement, you're going to get paid. If you sell them a Medicare Advantage plan, you're going to get paid. All right, so it really is incumbent upon you to have both the Medicare Advantage and Medicare subs in your arsenal. By having these different products, it provides additional choices to your clients, and it's going to mean more sales to you. If you're merely relying on supplements today, I can guarantee you that there's an agent out there looking to steal your clients. And it's really interesting, for those of us who've been in the business for a while, if you look at it, with our under 65 clients, they never want to talk about their health. They hate to talk about health insurance. It's a necessary evil that they really don't want to deal with. But when people get to the age of 65, they love to talk about their health conditions. They love to talk about their health insurance. And so when Betty and Susie and Jane are hanging out in the senior center in Lyle or wherever it is, they're talking about what's going on. And when Susie says, hey, I just got a rate increase on my Plan F supplement, it's going to be $300 a month now, and I got my drug plan, I'm paying $350 a month, and I don't really use it that much. And Jane says, hey, I've got this $0 premium Medicare Advantage plan. You don't think that Susie's going to want to know more about that $0 plan? If you're not offering the Medicare Advantage, you're missing the opportunity going forward. All right, a couple quick facts on Medicare Advantage. As I mentioned, everywhere else in the country, most beneficiaries choose this option. It's 2-to-1 across the country, Medicare Advantage versus supplement. This is all carriers across the country. Okay, most carriers typically offer a $0 premium. You cannot use the word free under CMS guidelines. It's a $0 premium for most HMO plans in the marketplace, and very reasonable premiums if you want a PPO plan. Okay, here's the kicker. Commissions on Medicare Advantage are actually typically much higher than on a Medicare supplement, usually about a 2-to-1 ratio. So if Medicare Advantage is potentially the right solution for your client, and you can make more money, why wouldn't you take the time to certify? All right, I always love to say that if you guys were out there selling widgets right now, and Joe was doing a webinar for you, and I said, hey, if you did 15 hours of certification every year, you could make twice as much on every widget, would you do it? And I can tell you, every time I bring that up in a training class, I see a bunch of heads bobbing up and down saying, well, yeah, Joe, I'm no idiot. Of course I would do that if I could make twice as much on every sale. Well, that's what we're telling you to do with Medicare Advantage. You make twice as much on every sale. Your clients are usually in a much better financial position with Medicare Advantage. So it really is truly a win-win for everybody involved in the process. Now, there are absolutely times that Medicare supplement makes more sense. So there's nothing wrong with it when a client wants to choose Medicare supplement. And sometimes I have clients when they're turning 65 and they just simply can't make up their mind. And I'll sit there and tell them, listen, just let me put this out for you. Rest assured that whether you choose Medicare Advantage or whether you choose a Medicare supplement, you're going to be well taken care of. It doesn't matter. Either plan works really well, and you have the opportunity to change every year in the open enrollment period. So you're never locked in. You always have options going forward. And usually that allows us to move forward and get them onto the plan of their choice. Okay? This compliance component that seems to scare the heck out of everybody, trust me, it's not that hard. It can be learned. It can be learned very easily, and Flex is here to help you with that. The whole reason that Larry and I exist is to help you guys learn how to go out and find the Medicare eligible people so you can help them, teach you how to do it compliantly, and how to offer them the right products. Okay, and we'll have more of that as the summer goes on, as we get ready for open enrollment. We'll take you through more of that compliance training. We are here to help you guys with that. That's why we're here. So don't despair over that. It's really not hard, and once you kind of get used to it, it's pretty straightforward and pretty simple. All right? Again, there are absolutely times when a med sup makes sense. Okay, it's a great alternative for a beneficiary who travels frequently. Okay, they're retiring, they've just turned 65, they bought the big Winnebago, and they're finally going to go see all the places in the country they never got to before while they were raising their kids and sending them off to college. Okay, in that scenario, it's great because there's no network involved with the Medicare supplement. If you want to go to the Mayo Clinic in Minnesota or the Cleveland Clinic, go. As long as that doctor accepts Medicare, you can go see him with a Medicare supplement. So there are times when the sup makes perfect sense. If they're in serious ill health, there's a lot of peace of mind by just putting them on a Medicare supplement because they're typically, on most supplements, not going to see a bill after a hospitalization or a surgery or whatever. So there's a peace of mind factor that comes in with a Medicare supplement. Okay? And maybe they just simply don't want the additional benefits that are available in most Medicare Advantage plans that you don't get with a supplement. Maybe they just don't mean anything to them. So there are definitely times when a supplement makes sense. I'll give you a quick example. Last week I was working with a couple in Bolingbrook, and the wife is retiring. They're both going on to Medicare now on June 1st. She needs a knee replacement. She loves Medicare Advantage. Her husband wants to be on a Medicare Advantage plan, but she needs to have a knee replacement surgery. And the doctor that she has chosen to do this knee replacement surgery is out of Rush. Well, unfortunately, typically the teaching hospitals are not available to us in the Medicare Advantage plan, so Rush, North Shore, those types of places, Loyola, typically will not be available to us. So the doctor she wants is only going to be available to us through the supplement. So she's going to go ahead, and we signed her up for a supplement. She's going to get that knee taken care of, and if everything goes well, when the open enrollment period opens in October, Joe's going to go back out there and put her on a Medicare Advantage plan going forward. So she gets that knee taken care of, she gets the doctor she wants, but going forward, she loves the idea of how the Medicare Advantage plan works. All right, so here's the important part of all this, right? We talked about earlier all the madness going on in the under 65 market and getting our commissions taken away and all that good stuff. Medicare is stable. You will get paid. We've already talked about how big the opportunity is and how there are far too few agents taking advantage of it. So again, to recap it, your first year commission on a Medicare Advantage plan is $429. Doesn't matter what plan you sell. It can be United Healthcare, it can be Blue Cross, it could be Humana or any of the other carriers in the space. You get $429 if they're new to a Medicare Advantage plan. Your renewal commission going forward is $215 for life. The stick rate on Medicare Advantage is about 94 or 95%. Once people are enrolled in Medicare Advantage and they understand how it works, they typically don't leave these plans. So you get paid as long as that individual continues to be on this earth, you continue to get paid. So you can start stacking up a very profitable business in the Medicare very quickly. Okay? Your typical first year commission on a Medicare supplement is somewhere around $200. So not bad, but it's half of Medicare Advantage. Okay, your renewal rates are going to vary by the carrier. Prescription drug plans, you're going to make $63 first year commission and $32 on renewal. So there is opportunity to make money. Medicare pays far better than our under 65. How many times have our commissions been cut in the last 6 or 7 years? It's brutal. It's absolutely brutal. All right, so let's talk a little bit about selling Medicare. Okay, how do we get this done? There's really kind of two approaches when you're out in front of your client. Again, the key thing, what I always tell my clients, is you really have 3 options. You can go with original Medicare, and if you know you're going to be perfectly healthy because you have a crystal ball on your table and you can see the future, and you know that's going to happen, hey, roll with original Medicare. It'll be fine. But remember, with original Medicare, you're on the hook for 20% of the cost. So really, original Medicare should be off the table. So there's really only 2 solutions going forward, Medicare Advantage or Medicare Supplement. And I always say it jokingly, even to myself, if you walk out of somebody's home who's new to Medicare without a sale, you've done something really, really wrong because they need it. They only have 3 options. One's bad, so there's only 2 options, so which one works best for you, Mr. Client? Okay, so you have 2 approaches when you're talking about their plan options. You can do what we call the high to low approach. That's where you start with the Plan F supplement, which is going to be your most expensive plan option because it's the most comprehensive. It leaves the client basically with $0 out of pocket for any claims. Okay, and then you work your way down to a G, which is actually a better deal and covers the same things that F does, and is becoming much more popular. Then you can work your way all the way down to the high deductible F, which is a tremendous option for people that love the supplement but are in relatively good health. They can save a ton of money over time with a high F. And ultimately, you get down to the $0 premium Medicare Advantage. So you're going from higher fixed costs to lower variable costs. okay? On the low to high approach, you're just literally going the exact opposite way. You're starting from the $0 premium Medicare Advantage and working your way up to the most comprehensive and expensive Plan F supplement. All right, so let's do a little illustration of how we might want to look at how these things work for us. All right, so let's talk about how that claim would be handled using the high to low or low to high approaches. So my client, Billy Bob Jones, ends up being admitted to the hospital due to his unpaid gambling debts and leaves with a bill totaling $57,760. And don't ask me why we picked that number. It's just a good number. It can be a legitimate hospital bill. I think everybody's well aware it doesn't take much to get to that kind of number in the hospital these days. So, all right, and I was just trying to throw a little levity in here because this is Chicago after all, and we do things the Chicago way, right? So my poor client, Billy Bob, just didn't pay his debts, and he ended up in the hospital. All right? So if he's on original Medicare, he's going to have to pay the first $1,288 deductible for the occurrence of his hospitalization. All right? Beyond that, all of his follow-up stuff is likely to fall under Part B, and he's going to have to pay 20% of all of those costs, assuming that he did enroll in Part B. And that's the key. He's got to be on Part B in order to get those benefits. Otherwise, he's going to get 100% of the costs. And his hospitalization benefits are going to be limited. So if he got beat up really bad and he ends up in the hospital for a long time, you can see how the expenses can quickly add up. And Billy Bob can be out of pocket a lot of money to the hospital. It's bad enough he owes his gambling friends. Now he also owes the hospital a bunch of money. All right? So hopefully, if he worked with most brokers in Illinois, he probably ended up on a Plan F supplement when he enrolled in Medicare and first became eligible for Medicare. So now that Plan F is going to cover all the expenses of that hospitalization and the follow-up stuff. So that $57,760 is now covered. He doesn't have to worry about it. He's taken care of. The downside, though, of the Medicare supplement is that supplement increases in cost every single year. It will continue. As long as Billy Bob is with us, the cost of his premiums, just like our under 65 insurance, is going to continue to increase. Okay? But he's covered. He's well covered his hospital expenses, and a Plan F supplement even gives him a little bit of emergency coverage up to $50,000 lifetime overseas. So if Billy Bob's got to get himself out of the country now because his friends are looking for him, he will still be covered for emergency when he goes out of the country. All right, let's look at it from the low to high approach. Billy Bob worked with an agent who's actually certified to sell Medicare Advantage and decided that Medicare Advantage is probably the better opportunity for him. The HMO plans typically in our market have about a $3,400 maximum out of pocket, but right below this you'll see it's really difficult to actually reach your maximum out of pocket on a Medicare Advantage plan. In fact, only about 4% of the plans nationally max out. So that means 96% of the people on a Medicare Advantage never come close to that $3,400 maximum out of pocket. Okay, but even if Billy Bob spent 4 nights in the hospital, he typically is going to have somewhere around the $250 a night copay for that hospitalization. It might cost him $1,000 on a Medicare Advantage for that hospitalization. But here's an illustration of what it would take to get somebody to that $3,400 out of pocket. You'd need 7 days in the hospital, maxing out that $250 a night, 20 days in a skilled nursing facility, 9 primary care visits during the year, throw in a specialist visit, a couple of ambulance rides, 5 lab tests, 5 x-rays, and, oh, by the way, on top of it, a $2,000 outpatient surgery. So he would need a lot of stuff to go wrong to ever hit that maximum of $3,400 out of pocket, okay? Medicare Advantage plans also typically cover things for the member that original Medicare doesn't cover. And so there's a lot of additional benefits that Billy Bob could get by having a Medicare Advantage plan that he might not get on original Medicare or a Medicare supplement. All right, let's talk about a few of those benefits. Podiatry services, typically not included under a supplement or original Medicare. The plan may offer vision and hearing and dental benefits. They're going to get a health assessment call from the carrier. Hey, just wanted to get a baseline and see how we might be able to help you manage your health. They will have a 24-hour nurse line available, so if somebody's having a problem, can't get to the emergency room or doesn't think they need to go to the emergency room, they can call the nurse line to get advice on what's going on. Okay, some additional benefits that most of the Medicare Advantage plans we work with offer, something called Silver Sneakers. That's a free gym membership, and it's not limited. It's places like the YMCA, Lifetime Fitness. All you do is put in your zip code at silversneakers.com, and it'll bring up all the gyms in the area where somebody can go take advantage of a free gym membership. Okay, a lot of the plans offer you an over-the-counter stipend monthly to buy things like aspirin and cold medicine, Band-Aids, whatever it is. These are all free benefits on top of your $0 premium Medicare Advantage plan, and a bunch of other optional riders and things that you can add on to your plan if you want a more comprehensive dental plan or whatever it may be. Okay, so there's a lot of additional benefits. It's been proven by CMS that the very best patient outcomes for people on Medicare come through Medicare Advantage plans. Why? Because the plan has a vested interest in the individual's health. The healthier that individual is, the better the patient outcomes are, the more money the plan receives from the federal government. So it's truly in their best interest to offer these additional benefits. They know if they get you to the gym, you're probably going to be healthier because they've got you moving and got you exercising, right? All these things add in to, it's just a self-serving thing by adding these additional benefits. It just helps their members stay healthier. They make more money. All right, let's take a look at another case study here. All right, today many people are working beyond the age of 65. Okay, helping these individuals make the right insurance choices will vary based on the unique circumstances of each person. Okay, this is where you really come in as a trusted advisor to help the client understand what their options are and which one makes the most. Again, we're going to go back to that financial sense, because in the next couple of slides you're going to see there is a difference. Okay, this is definitely very critical for people working for small employers with less than 20 employees. Why? Because in that scenario, Medicare becomes the primary over the group plan, and unfortunately, a lot of these people are not aware of the fact that they need to enroll in Part B, because if they don't, all the doctor and outpatient testing, the MRIs, the CAT scans, all that fun stuff, the lab work, is not covered if they're not enrolled in Part B. They're going to get 80% of the cost because the government's only paying 20% of the cost because they're paying secondary on these small group plans. Okay? That's the key to this. So if you're working with somebody, ask them, okay, I'm on a group plan. What type of company do you work for? Is it a small company? Are there less than 20 employees on the plan? That's critical discussion. If they're on a large group, the situation turns because the group remains primary and Medicare pays secondary. All right, so let's look at this individual's cost on a group plan. Okay, and we're going to stay in that smaller group, under 20, right? Okay, typical monthly premium for that individual is about $550. That's pretty typical these days. It's usually somewhere between $500 and $600 for an individual. These days, usually the employee's paying about half of that, so they're taking $275 out of his check every month. And I was very generous on the next part of this slide. Okay, we're saying this plan still has only a $1,000 deductible. I think you'd all probably agree with me that in today's world, that's a really low number. Okay, and only $1,000 additional out of pocket. So the maximum out of pocket on this plan is only $2,000. Realistically, today, it tends to be $3,000, $4,000, $5,000. I've seen them as high as $7,500. Okay, so I was very generous keeping this on the low side. Okay, this plan has a $20 copay for doctor's visits, prescription drug plan tiered at $10, $30, and $50. So let's assume that this individual goes to the doctor about 4 times a year, and they're only taking one generic and one preferred brand drug at this point. So let's look at their costs going forward. Okay, he's paying $275 a month in premium out of his pocket. That's $3,300 a year. His Part B premium, if he's been on Medicare, is $104.90. That's another $1,200. If he's new to Medicare this year, it's actually a little bit higher. The premium's $121.80 for 2016 if you are new to Medicare. So it's a little bit higher if he's new this year. Okay, he's going to that doctor 4 times and he has a $20 copay, so that's $80, and his prescriptions are going to cost him $480 for the year. So his total cost, if he doesn't go to the hospital or anything else, he's looking at $5,119 out of pocket. That's his cost to be on his health care on a normal year. Okay, so now let's take a look at what his option would be if we put him on a Medicare supplement and a Part D drug plan. He's still going to pay that Part B premium, so that cost stays the same. Your Plan F is going to be, like I said, right around $160, so he's about $1,900 for his premium. The office visits are going to be free. He's on kind of a mid-tier drug plan. It's going to be $39 a month, so that's another $564. And his drugs, the copays are going to be typically pretty similar to what he had on the group plan. So now his total out-of-pocket expense for the year is $4,175. So he has saved about $1,000 by just getting off the group plan and going to a Medicare supplement. Okay, you guys probably can see where I'm going, but on the next slide, let's talk about his costs on a Medicare Advantage plan. He still has to pay that Part B premium. That never goes away. Okay, we can't escape the Part B premium. But now it's a $0 premium plan because we found all of his doctors in the HMO network and he's happy. Typical copay for a doctor's visit primary care is $5. So now he's paid $20. He doesn't have a Part D premium because it's included in his Medicare Advantage plan. On a Medicare Advantage plan, his copays might be slightly higher for the prescription, so we went a little bit higher. $600 now out of pocket for the year. So now his total expense is $1,871, and he's saving $3,200 out of his pocket by being on the Medicare Advantage plan. So this scenario works for your person who's just retired at 65, or the guy who's on that small group plan. He's probably better off on a Medicare Advantage plan, assuming we get his doctors in network on the plan. All right, let's take a look at another quick case study, and then I'm going to turn things over to Larry here. But on this case study, let's look at group versus Medicare. Now we're going to throw in, there's actually a hospitalization involved. So now does this change our math, right? Okay, it's a $50,000 hospital bill, okay? He's still going to have all those other typical expenses for the year, okay? Those don't go away. We don't escape those, okay? Well, under original Medicare, it's going to cover everything for the hospitalization except for that copay, and that's a per occurrence deductible, that $1,288. So if something happens later in the year and he gets hospitalized, he's got to cough up another $1,288 plus the 20% for everything. So you can see where these expenses add up. So let's take a look at what his out-of-pocket costs would be in this scenario. Okay, on that group plan, he's going to pay that $5,119 that we talked about before, the cost of all the premiums, his out-of-pocket expenses. Now he's got to satisfy that $1,000 deductible, and again, I was being very generous with that deductible, and the $1,000 in coinsurance, because at a $50,000 bill, he's going to max his coinsurance, right? So now his total out-of-pocket costs for the year are $7,119. All right, so you can see where things can add up pretty quickly. All right, now he made the smart choice and he chose a supplement. All right, he's going to have no additional out-of-pocket expenses for his hospital bill if he has that Plan F supplement. So his total expense remains the same, $4,175. So now he's saved almost $3,000 versus being on the group plan. Unfortunately, the human resources manager at the employer, they typically don't understand how Medicare works. The individuals out there don't understand how Medicare works. And we've just been kind of groomed to believe that the group plan is the best solution. I'm just going to stay on the group plan. But I think you guys are starting to understand that that's not typically the best option. Okay? Now, there might even be a better alternative, Medicare Advantage. In this scenario, we'd add another $1,750 in costs for his hospitalization. All the other remaining costs remained the same. So his total expense went up a little bit here, $3,621, but he has still saved basically $3,500 versus the group plan and still saved over the supplement. And the average person over the age of 65 only gets hospitalized once every 7 years. So over time, you're going to save more money on the Medicare Advantage plan. All right, I'm going to drive this home with one more slide, and then I'm going to turn things over to my counterpart, Larry, so he can bring the ship in for you guys. But let's look at the lifetime cost savings with a Medicare Advantage plan versus a Medicare supplement. And I used, again, a very generous illustration. Okay, let's take somebody from the age of 65 to the age of 82, a 17-year span. As we've illustrated earlier, people are easily living to the age of 82 today. That is not uncommon at all, right? All right? Well, the average premium for that person on a Plan F supplement over those 17 years will come out to be somewhere around $243, depending on the carrier and all that good stuff. But that's a good, solid number. And they're going to pay, an average drug plan in the United States today is about $35 a month. So they're going to be paying about $278 a month in combined premium. That's $3,336 per year. Over 17 years, that individual is going to spend nearly $57,000 in premium, regardless of how much they use it. That money's out the door, whether you're somebody like my mother-in-law who lived to be at the age of 92, and she was one of those that went to the doctor 2 or 3 times a year, and that was it. The night she died at 92, the last time she had been in the hospital was 52 years prior when my wife was born. She just was one of those. Until I got her switched over to a Medicare Advantage plan, she had given a lot of her hard-earned money away on her Medicare supplement. Okay? The average maximum out of pocket with the Medicare Advantage plan, again, is only $3,400. So over that same 17-year period with a $0 premium, and that's what I put my mother-in-law on, okay, the savings up front would be $57,000, but that's not realistic because likely somewhere during that 17 years, the individual's going to get hospitalized, and they're going to have some out-of-pocket copays along the way with their plan. Again, I said earlier that that individual typically only gets hospitalized once every 7 years. So let's give them 2 hospitalizations during that 17-year where they actually max out their plan. So they hit $3,400 twice, and all the other years they average $700 in out-of-pocket expense. And trust me, that is a realistic number. They're still going to save at least $30,000 of their hard-earned dollars. This is real money for your clients out there in their retirement years. They're living longer. They need to stretch their money further. If you can help put $30,000 back in their pocket, you are a hero to them. And as I said earlier, if you're not the one offering the Medicare Advantage as a solution and you're only offering supplements, I can promise you that other agents out there are going to be coming in behind you and stealing your clients with Medicare Advantage. All right, at this point, I'm going to turn the presentation over to my counterpart, Larry, and he's going to talk to you about getting certified for Medicare, and he's going to talk to you about how Flex can help you get ready to take advantage of the tremendous opportunity that we have in Medicare. I want to thank everybody for taking the time to join us this morning, and I applaud you for your interest in getting involved in the Medicare space. For all the reasons I've illustrated in the first part of the presentation, this is a great opportunity, and I look forward to working with you guys going forward, and I'm going to give it over to Larry to take us through this last part of the presentation here.
All right, thanks, Joe. Medicare certification, what you have to certify for is Medicare Advantage plans and Part D drug plans, which is very important because you want to sell all of Medicare. You don't want to just sell Medicare supplements. To me, it's either you sell Medicare or you don't. Offer your clients Medicare supplements, Medicare Advantage plans, and Part D drug plans. There are many brokers, most of our brokers sell just a Medicare supplement, and they would have to refer their client to me to do a drug analysis to sell the Part D drug plan, and their clients call me saying, how come my client doesn't do this? And I have to tell them, well, your broker didn't want to certify this year. It does take, there's AHIP certification, it takes about 5 or 6 hours, and then if you get certified with a couple more carriers, it could be a little over 10 to 12 hours of certification, but it's well worth it financially for you. The Medicare Advantage certification, it's open right now. AHIP is required certification for most carriers. It covers the basics of Medicare. When I say it's open now, it's still open for 2016 if you are meeting clients that are turning 65 or coming up their group plan. You could certify up until, I believe, June 20th. Then after that, it's going to roll into certification for 2017, right around July 1st or so. When you do the AHIP certification, you complete the courses on the basics of Medicare, rules and regulations, fraud, waste, and abuse, and you have to pass an exam. Don't wait. The sooner you get contracted and certified, the sooner you can start helping these people, and you actually get paid. As I said, it will be around July 1st, where you could certify for open enrollment, which starts October 15th to December 7th for a January 1st effective date. Do it as soon as you can. Don't wait until September or October, because a lot of people are getting ready for individual open enrollment. Group brokers are getting ready for their clients and their customers who are changing groups as well. So right now, the middle of the summer, starting July 1st, August, it's a great time to certify. Just 1 second. Here we go. And here's the links. We'll be sending these out. These are links that are available today for 2016. It's ahipcertification.com. You go to AHIP. If you are appointed with Blue Cross, they have a link with their logo on it, and you receive actually a discount. And you log in with your MPN number. Then once, for 2016, this will change in 2017, but for 2016 and years prior, you have to do the AHIP certification first. Then you transfer your credits to the 2 other carriers that we sell for Medicare Advantage and Part D drug plans, which is Blue Cross and United Healthcare. You usually have to wait about 48 hours, make sure it's on their website, and then you can do the training. Blue Cross at Compliance Wire, and for United Healthcare will still be UnitedHealthProducers.com. We are told for 2015, once you do your AHIP, you could immediately go into the other carriers and do their certification right after that. You wouldn't have to have a delay of 48 hours. They're trying to make it easier and hopefully condense it so it takes less time to get your certification done for 2017. Compliance, there's different types of events going on that you could put on. Educational, it's designed to inform Medicare consumers about Medicare Advantage Plan, Part D drug plans, and other Medicare plans. You cannot steer or attempt to steer potential customers toward a specific plan or a limited number of plans. Educational events, we have brokers that give the presentation that we have. It's called the ABCs of Medicare. It's just talking about the basics of Medicare. You're not talking about plan specifics. You're not talking about carrier specifics. So you usually don't have to you don't have to register it with CMS for approval to do that. The other type of event is a sales event that has to be okayed by CMS. It is designed to steer or attempt to steer consumers toward a plan or limited set of plans. So you are talking about the carriers, what plans they offer, and things like that. At a sales event, you may discuss plan information, such as premiums, cost sharing, and benefits. And agents may distribute or collect enrollment applications. CMS considers a one-on-one individual appointment to be a sales event. These appointments are not reported to the plan or to the CMS event. Usually when you have a sales event and you register with CMS, you may have a secret shopper for CMS to make sure you're doing everything in compliance. There's a formal sales event, typically structured in an audience, presenter style, specific plan sponsor information provided as part of the formal presentation. But then there's something called informal sales event. It's conducted with a less structured presentation or a less formal environment. There's no formal presentation. Agent provides plan information to individuals who approach the booth or the table. So you're not really handing out specific plan materials, but you have a booth. A lot of senior health fairs, brokers set up a booth with different carrier information on there, but they approach you. They can ask you for your card and take the information that's on their table. So that's a little bit more informal. Why work with flexible benefit? We have a roadmap for success. Most of your brokers listening today probably have your health and life course that you took and your health and life exam. You have to get contracted with the different carriers. Blue Cross Blue Shield and AARP United Healthcare, we have their Medicare supplements, Medicare Advantage plans, and their Part D drug plans. We also have Mutual of Omaha, which is Medicare supplement only. Once you get appointed with them, you should do your AHIP course and exam, and then do the carrier-specific certification, which is Blue Cross and United Healthcare, because they have the Medicare Advantage plans plus the Part D drug plans. We are also offering courses throughout the year, webinars and seminars. The basic one is the ABCDs of Medicare that we have to get people interested, brokers interested in selling Medicare. We also have it available for you to use if you want to give an informal presentation on the basics of Medicare. You are looking right now at this presentation, which is New to Medicare, Now What? Basically telling you how to get started and what to do. And then there's the how and why to sell Medicare. Not only how to sell it, some probing questions that you ask your clients to determine which is the best plan and options for them, and why to sell it. Usually why to sell it because it's the largest booming market out there to sell insurance, the Medicare market. We have a workshop in our office here. It's called the Medicare Marketing Workshop. This is the most popular workshop that we have. We actually will show you where to go to get in front of Medicare eligible people and do a presentation. And you'll have an audience of Medicare eligible people. I've done this myself with brokers. I'm doing the presentation because the brokers at first are not that comfortable with it, but everyone I do, they come up, before they even come up and ask for the broker's card, they say a few minutes later and they ask a lot of questions. We tell them we will stay as long as they need us, and they come up and ask for the broker's card. The brokers get appointments, and eventually that leads to sales. We also have a business planning workshop to show you how to plan out your business, and if you decide you want to sell Medicare, how much money do you think you want to make in Medicare, and we could show you what you would have to do to accomplish that. And we also have a low-income subsidy webinar as well. And low-income subsidy is for people to help them with their drug costs, which could be their premium. Their co-pays will be much lower, and it'll also cover their costs through the donut hole or the coverage gap. Myself, Joe, we just heard Joe Gladys and Mary Ann Graben. We are working a Medicare market. We could do one-on-one coaching, either in your place of business, in our office, or just go out in the field with you to meet clients or put on presentations for you. Besides appointments, we have something called local area marketing. We'd like to call that lambing. That's where you're working your local market to find people to get in front of, such as libraries, senior centers, assisted living places. We'll show you how to put on a presentation, an educational event, a sales event, and also talk about low-income subsidy to people as well. We'll help you set goals for yourself also. Excuse me. We'll review your business to make sure you're on track. You submit your applications and business to us, and we will track it for you. We scrub the applications and make sure everything's correct before we submit it to the carriers. And how Flex supports and provides value to our agents. First, you are paired with an experienced sales consultant who's your go-to coach, mentor, trainer, and advocate. Anytime you call here, myself, Larry, Joe, and Mary Ann, whoever picks up the phone could answer your question, but you'll be paired with one of us to go out in the field and meet one-on-one. So if you need Joe or myself or Mary Ann to help you with a presentation or sit in front of a client to see what's the best options for them, we will help you do that. We help you get ready to sell Medicare by getting you contracted with the carriers. We make sure that you get certified. We will be sending out notifications all the time on when that's going to happen. And the best thing is when you get the notice from us and from the carriers, the certification is open. I would suggest that you start that right away. To put it off, another couple months, could be September, end of September. Well, you could actually start talking about Medicare Advantage and Part D drug plans starting October 1st. You can't sell a plan or take an application until October 15th, but you start talking about it October 1st. So the sooner the better, the more prepared you are, the more information you have to provide to your clients. We'll do one-on-one group product and positioning training. We help you grow and manage your business. We have business planning services. We lead agents in the development of an annual business plan. We help you set up what your goals are, and we'll also show you what a SWOT analysis is. We have you write down, and we do this on our marketing workshop as well. A SWOT analysis, when you put it down, one's strength, weakness, opportunities, and threats. When you can see what your strengths are, that's what you should focus on. And then also, if you know what the opportunity is, look at that opportunity to target your business. And threats, know what your threats are out there as well. And usually the main threat is competition from other brokers that are into Medicare and selling the Medicare Advantage, and you might think that I'm only selling Medicare supplements, so I got to get on board as well and sell Medicare Advantage plans. I don't want those other brokers to be a threat to me. We'll give you some strategy and tactics on how to sell, and we'll measure your business as well. Training and a sales advisor will keep you abreast on industry trends and knowledge. Things are changing all the time. Provide value-added training on current relevant topics such as online and social media marketing. We could show you how to do that. Product and portfolio training by carrier offering. You know, every year during open enrollment, Medicare supplements, Medicare Advantage plans, Part D drug plans, that's when the carriers come out right around October. So that's when you actually start talking about it. So August, September, look out for some emails from our marketing department. And we're probably going to have either a webinar, or you could also come in as well, and we could train you one-on-one and show you the differences between the different carriers. Because we have two carriers that we sell for Medicare Advantage plans. One's not better than the other one, but some may offer something that your client is looking for. And same thing with Medicare supplements as well. We offer 3 carriers for Medicare supplements. Some may be better than others. One's a guaranteed issue, but the one that requires underwriting, if you're over 65, has a lower premium, and we'll show you when it might be the better option depending on your client's needs. Our marketing service advisor, target marketing services available to help you implement the strategies identified in your business plan. Will help you to identify what your business plan is going to be. We talk about local area marketing plan workshop that we have coming up as well. That's a great workshop to come to. As an example, I had a broker over the last few years. He only sold 3 or 4 Medicare supplements, and then I saw that he kept showing up on our webinar. And actually, that was for a couple years. He's showing up on our webinar, he's listening to it, but he never showed up to our workshop. He showed up to the workshop last year and heard about the presentation that we give for ABCDs of Medicare, and I told him that other brokers have used that when they got in front of Medicare eligible people. And he came up to me afterwards, he goes, "Larry, I think I want to do that presentation, but I'm not sure if I'll be good at it. Could you help me?" My church does about 2 programs per night every single week, and they want people to give talks on different topics, and I'm thinking of doing one on Medicare. I said, that's a great place to do it. So he put up a bulletin board saying that he's going to do the basics of Medicare presentation. I did it for him, the first one. And then afterwards, people came up, asked for his card. The second time he went the following week, he did it himself. I made sure he was comfortable doing it. And what happened is he started after Labor Day of last year, and he did it all through September and all of October. In November as well. So he did about 2 a month. So he did about 8 presentations. And what happened with him, people were taking his card, he was getting appointments. And when open enrollment started October 15th and it lasted until December 7th, he sold 53 Medicare Advantage plans. And he sold, instead of selling 3 Medicare supplements, he also sold 15 Medicare supplements. So the audience he was in front of, a lot of them just had Medicare Part A and B, and that was it. Also, these people, and the reason they were on Medicare A and B, because they couldn't afford the premiums going up every year on the Medicare supplement. So he got a lot of those people to switch from their high premiums Medicare supplement and their Part D drug plan to Medicare Advantage plan. But just by selling 53 Medicare Advantage plan, he made over $27,000 in that, was it 7 weeks or so of the open enrollment? And he's very happy, and he's continued to open during this special enrollment to sell Medicare supplements and Medicare Advantage plans. And he said it's the best thing that he did is just doing a simple presentation. He got all this business because people are out there. They want brokers' help. It will teach you how to sell in Medicare in their local community. There's customizable marketing materials available to you on carrier websites where they have something you put on the bulletin board. Sometimes Jewel or Mariano's has a bulletin board as you go through the front door. There you can paste different things about different presentations you're going to give, and you can put your contact information right on these nice pieces of marketing material that the brokers put out, and it's on their websites. So we can be your business coach and implementation services to keep your business growth on track. If you want us to meet with you on a quarterly basis, we'll see how you're doing compared to your business plan and tell you what needs to be revised and any adjustments you might need as well. We're available to coach you at any time you want. Anytime you need us, just to call us. We have brokers calling us all day, and there's at least once or twice a day I have somebody calling me up, and they say, Larry, I got this unusual situation, and it's like putting pieces together of a puzzle. We always figure it out and figure out what's the best plan of action, and they usually call me before they see their client. So always call us. We will help you, walk you through it. If you need us to go out in the field with you as well, in front of your client or not, or give a presentation, we'd like to get out of the office and help brokers sell. Final thoughts? The final thoughts are decide your strategy if you're selling Medicare. What carriers do you want to offer? Recommendations are at least 2 Medicare Advantage plans. We offer Blue Cross and United Healthcare. What products will you sell? We recommend that you sell both Medicare, Medicare Advantage plans, and Medicare supplements. What demographic will you focus on? Do you want to just get into the Medicare market and focus on people just turning 65? Or do you want to focus on the annual enrollment period every year as well? You can start off small doing that, but the special enrollment, SEP, after open enrollment ends is a big opportunity as well, because people are coming off their group plan or they're complaining that the group insurance is too expensive, but they're over 65. It's a great way to get them enrolled during the special enrollment period when they come off their group plan. If you have questions, you can feel free to give us a call or email us with any questions you have about this presentation, and we will make sure to get back to you. Marketing tip, what's the most important thing you can do in terms of marketing? Tell people you sell Medicare. Use the 3-foot rule. I know Joe uses this a lot. If you're at a gas station pumping gas and you see somebody who might look like they're over 65, you just hand them your card and say, I'm a Medicare specialist. If you have any questions, give me a call. And people really appreciate it. You know, every year people during open enrollment are getting a stack of mailings from all the carriers, and they don't know what to do. I know in the presentation earlier, Joe showed you only one agent is selling 4,100 Medicare Advantage plans. When the people get a stack about 2 feet high of postcards from the carriers, they don't know who to call. So what they're doing is calling that carrier directly. They're calling Blue Cross, United Healthcare, Humana. It's best if they work with a broker who handles a few Medicare Advantage plans and show them the difference. So these people are really underserved. They really need brokers' help. And the one thing we find is people who are Medicare eligible, if you do them right, you sell them the plan that's right to them, they'll tell their friends, and their friends will tell friends, and they're very loyal, and they will always recommend their friends to you to help them out. Marketing materials available to you. We have some material here that we could send to you as well. Stay informed and connected. We have some upcoming events on June 9th is our Medicare marketing workshop. We could hold maybe up to 20 or so. If you're interested in that, let us know. We will be sending out a email on that if we haven't done so already, but that fills up pretty quickly. That will be at our office here in Rosemont. And June 16th, we'll have another webinar, the why and how to sell Medicare. So we'll go a little bit in deeper with some information on how you sell certain plans and why you should sell it. Follow us, again, at flexiblebenefit.com. Please call us with any questions or email us with any questions that you may have. Here's our contact information, mine, Joe, and Mary Ann's. Same phone number. We have different extensions there. I'll keep this up for about a minute or so, so any questions, please feel free to give us a call. I know it's a long presentation. We appreciate it, but it's really important because it's really a booming market, the Medicare market, and the brokers who have taken advantage of these webinars and seminars that we really started getting into it about 3 years ago. And brokers are shifting more to Medicare than they ever were before and are making more money. And Medicare is actually pretty simple. With the ACA, you know, it's complicated every year. You don't know what to expect, and it takes up a lot of time. Medicare is a steady opportunity to sell all year long, and it's not that difficult. The certification may take some time, but the certification, if you read everything, it's not that difficult. It just takes about 10, 12 hours to certify, but really, you'll benefit from it, make more money, and you'll be happy that you got into it because it's the largest market and it's getting bigger every single day. Thank you very much for attending. Please contact us, give us a call, and we will be sure to get back to you and help you out any way we can. We're always here. Thank you very much.